The title of this paper is Psychological Disorders and Stress Behaviors in Public Emergencies. Research on COVID-19 stress adjustment mechanism of foreign people based on resilience. Now, I will read my paper. The COVID-19 pandemic has engulfed the world, and critical conversations are occurring on best medical practice, public health guidelines, and further paramedics to rescue those impacted and society. In the aftermath, while much of the focus addressing the aftermath has been centered on achieving a vaccine and cure, the second tidal wave of patient inflow may prove to be in the mental health realm. Awareness, much like that which is being raised with government and pharmaceutical interests, needs to also include immediate needs of patients. Mental health after this crisis. COVID-19 diagnosis in the severe category is inducing acute respiratory distress syndrome that requires immediate intensive care unit care. Also, a large percentage of this subpopulation may recover from their physical diagnosis. Many of them will likely lasting mental health impacts, as the mental health link regarding ARDS has been well established. An article published in association with the National Heart, Lung and Blood Institute, ARDS network from the landmark study described the rate of psychiatric conditions acquired within 1 year of recovering from an ARDS admission. Patients were evaluated using the hospital anxiety and depression scale, and impact of event scale revised at 6 and 12 months. The number were striking as summarized from the study. 16.6 experienced at least one major diagnosis condition from anxiety, 42%, depression, 36%, and post-traumatic stress disorder, 24%. A high rate of co-occurrence of 3 conditions for younger female patients with high unemployment, and education levels will also revealed. An additional study conducted through 5 years with patients recovering from ARDS established similar mental health incidents. Independent of original ARDS severity in terms of patient length of stay and good diagnosis. This study found that 38% of patients developed anxiety, 32% depression, and 23% PTSD, with 52% of ARDS survivors having prolonged psychiatric morbidity in at least one of these 3 areas. Much of discussion of resource has been focused on protecting the elderly and at-risk medical population, which is just wide. However, given that nearly all seriously ill COVID-19 inpatient admissions are experiencing ARDS, and understanding the impact of ARDS on the development of mental health disorders, mental health professionals need to embrace this second wave of COVID-19 outcomes. It is also important to consider that the development of some mental health conditions after ICU admission may be marked by unique constellation of symptoms. For example, it was shown that PTSD resulting from an ICU admission depart its symptoms from those that developed after more traditional traumas, such as combat or assault. Furthermore, one crowd argued that the current crisis, which includes hospital ships and makeshift tents being used as ICUs, could exacerbate the trauma of the patient experience and result in even higher incidence of post-admission mental health disorders such as PTSD. To aid in this, we suggest that patients currently suffering from ARDS be given in hospital mental health screenings in hopes of identifying those of require for psychiatric evaluation and intervention before hospital discharge of those who need referrals to mental health professionals after hospital discharge. We suggest long-term follow-up care for patients with ARDS to include mental health screenings. Also, training should be private for mental health professionals on ARDS and psychosomatic connection, including the unique profiles, so that they are best prepared to care for the upcoming flux for patients. Finally, more empirical studies need to be carried out to determine whether best practice for treating mental health diagnosis remain the same for ARDS survivors with their resulting mental health diagnosis. The goal of this search is to explore the relationship between psychological disorder, resilience, and COVID-19 stress in order to contribute to overcoming the crisis of COVID-19 epidemic. In all the world, through empirical study on COVID-19 stress, the study tried to find an effective flexible adjustment mechanism that can buffer the stress response to public emergencies. Data collected from 1,248 Korean men and women sourced a network survey questionnaire were analyzed to test the research hypothesis. Also, several analysis techniques, including internal reliability analysis, exploratory factor analysis, descriptive analysis, multi-regression analysis, and severity were adopted by using SPSS 23.0 version. The findings of the study are as follows. Firstly, the study found out that psychological disorder, anxiety, and depression had a significant influence on resilience statistically. Secondly, depression was negatively correlated with all subcategories of COVID-19 stress, and anxiety had significant influences on COVID-19 stress statistically. Among the subcategories of COVID-19 stress, cognitive evaluation was negatively correlated with anxiety, but panic and defense response was positively. The relationship between psychological disorder and all subcategories of COVID-19 stress findings provided impetus for further investigation, testing additional hypotheses and mechanisms of COVID-19 stress behaviors. Why healthcare professionals, health insurance, and the government are preparing for health and financial aid for patients suffering from COVID-19. They must also support the upcoming mental health needs to these same patients. While the exact number of people who will be hospitalized for COVID-19 is still unknown. We don't know if some of them will face death, and that is itself should be a reason enough to discuss the mental health needs to these patients. Finally, we would be remiss if we did not make note of the countless people who will need mental health care after this tragedy, even if they were not diagnosed with COVID-19. For many will feel the impacts of this crisis through grieving the loss of loved ones. Unemployment, anxiety, and social isolation, all of which will require this one mental health treatment. Thank you.